you would turn your head just a little bit to the side. The internal and external jugulars are not extended on either side. The carotid pulse, which is checked just below the angle of the jaw, is present, and you always check one at a time. You never include both due to the potential for bradycardia and hypoxia. I'm going to listen to those. There are no grooves noted on either side. You can scan the room now. And I'm going to step away while you do that and let you scan completely. So the battery's done. I think if I get right here to plug it in, that should be okay. And I'll just...
You can always turn our chairs a little bit.
Okay. Got it, battery. I'm going to look at your nose and look at it inside and be touching it and things like that. So first you're going to feel the bridge of your nose. Has your nose ever been broken? I don't feel any traumatic lumps or bumps. Is that tender at all?
No.
Okay, what about on the tip? Okay. I'm going to look, if you would tilt your head back, look inside. The inferior turbinate is visible, the superior is not. The septum, there is no deviation and no trauma to that. The nares are equal bilaterally. There is no foreign bodies. The mucosa is pink and moist. There are small cilia hairs noted, which is normal bilaterally. I'm going to close one side and get you to breathe through the other side. Okay, and then we're going to do the same with this. Okay, and then we're going to test the first cranial nerve, which is the olfactory nerve. I'm going to get you to close your eyes, and I'm going to have you smell something with one side of your nose and then smell something else with the other side of your nose. And if you will just verbalize what you think the scent is. Okay? Okay, took off 50 for me. 7, that's correct. Okay, now we're going to close this side and smell.
Ooh, that's vinegar.
That's correct, that is vinegar. The good one, then the bad one. Oh, I'm sure I get the lid on that good. Okay. All right. I'm going to be looking inside your mouth and feeling and doing some different things and testing some different things with your mouth. Okay. All right. The lips are pink, they are symmetrical, they are moist. If you would open your mouth for me. Okay, to test your hypoglossal nerve, if you would stick your tongue out and wiggle it from side to side, stick your tongue out. There we go. Okay. If you would just say the word ah, just make the sound ah.
Ah.
Okay, and swallow. Okay, and I'm not going to be mean and test your gag reflex. But that indicates that the 10th and 11th cranial nerve is intact, are intact. Okay. Okay, can you open your mouth for me? Okay, put your head back just a little bit. The buccal mucosa is pink, moist. I see no open lesions. The gums are pink, they are not receding. I see no lesions, no redness. Okay. Can you stick your tongue out? Okay. The tongue is pink, moist, papillae are noted on the dorsal side. Could you put your tongue in the roof of your mouth, please? Okay. The underside, ventral side of the tongue is well vasculated. The sublingual frenulum is intact. Okay. The inferior frenulum is intact, or the superior, and the inferior frenulum is intact. Okay. Okay. If you would open your mouth again for me. I'm going to count your teeth. I notice dental carie on the back tooth here, on the lower left-hand side. There are 24 teeth. Okay. I notice a dental carie on the right second tooth from the back on the lower side. Look up just a little bit for me. There are no dental caries noted on the upper teeth. Okay. I'm going to feel, okay. The hard palate is intact and continues back to the soft palate. The hard palate is rugged and continuous with no bulging or calcifications noted. Stinson's duct is noted and is producing saliva. Okay, I'm going to feel underneath your tongue. If you would put your tongue in the roof of your mouth for me. Okay. Open just a little bit. Wharton's duct is palpable and it's producing saliva, as are the sublingual salivary glands. The tongue moves easily. Okay, I'm going to be checking your thyroid, your trachea, and feeling of those, and I'm also going to be assessing your lymph nodes. Okay. First, I'm going to check your sinuses. The frontal and maxillary sinuses, are they tender at all?
Yes.
Can you mesh? Okay. All right. Okay, I'm going to check the preauricular lymph nodes, the postauricular lymph nodes, the submental, the submandibular, the submaxillary, the anterior cervical chain, and the posterior deep cervical chain, the occipital, and if you would shrug your shoulders, there we go. I can feel four of these subclavicular lymph nodes, okay? None of the lymph nodes are palpable, and that is what you want. Swollen lymph nodes indicate infection or something like that, so, okay. The trachea appears midline. If you would swallow for me, okay. It remains midline. I'm swallowing. You can, I'm sorry. Okay. The tracheal cartilage is palpable, as are the outerline horns of the hyoid bone. Okay, you would swallow one more time for me. Okay. You can feel the bone and the cartilaginous rings, thyroid cartilaginous rings move from swallowing. I'm going to step behind you and attempt to palpate your thyroid. The thyroid did move upon swallowing. All right, if you would tilt your head just a little bit this way and lean forward. There's the sternal notch. And you go between the trachea and the sternocleidomastoid muscle. Okay, could you swallow for me? Okay, the thyroid is not palpable, but that is normal. I'm going to auscultate the thyroid. Okay. There are no bruits noted. Increased blood flow through the thyroid sometimes indicates an enlarged thyroid, but I did not hear that. Okay. We're going to be looking at your ears and doing some ear tests. But first, I want to do a couple of more things with your eyes. I know that we did several motions and movements. We did not do what's called a cover test and an uncover test. And what that does is make sure, I guess in layman's terms, it helps check for a lazy eye. Okay? If you would take and cover your left eye and look straight ahead at me, and then remove your hand. Okay? There was no deviation noted. All right, I'm going to cover this eye and get you to look right at my nose. Okay, there was no deviation noted there, so no lazy eye. Okay, we did the 6 cardinal gazes. We peeked in there to see what we could see, and everything looked okay. Do you have any concerns about your eyes or your ears or anything like that today?
No.
Okay. No pain in your eyes? You're not having an earache or anything like that? Okay. Well, we are going to check your ears. The ears are symmetric. The pinna is even with the eyebrow and extends above the outer canthus of the eye. Just look right up here at me. The pinna are easily movable. The helix recoils well. The tragus is movable here. Tragus is movable here. Helix recoils well on this ear. The ears are pierced. I'm going to mash back here what they call the mastoid process, and tell me if you feel any pain when I do that. No? Okay. And on this side? Okay. All right. The external auditory meatus is clear with no drainage noted. We're going to look inside. If you would tilt your head slightly that way for me. Okay. There is no lesions noted in the canal. The canal is clear. There is a small amount of golden colored, malleable, soft cerumen noted, which is normal. The tympanic membrane is visible, as is the pars tensa, the pars flaccida, the ova, and the malleus. Okay. If you would hold your breath and kind of bear down, okay. That shows if your tympanic membrane is moving correctly, and it is. It also establishes the patency of your eustachian tubes. Okay, everything looks okay. And we would do the same in the other ear. I'm going to do what's called a whisper test. If you would close your eyes, and I'm going to whisper just a short sentence and on each side, and get you to repeat what I say, okay?
I like dogs and cats.
Okay. And on this side,
That's how that side too.
okay, very good. That checks for high frequency hearing, okay? I'm going to use the tuning fork and do what's called the Weber test and the Reynolds test on your hearing. I will be giving you instructions on what to do. The first one I will be placing here, and I need you to tell me if you hear it equally in both ears or louder in one ear, more in one ear than the other.
Okay.
Okay. Do you hear that equally in both ears?
Yes.
Okay. All right. That was the Weber test. The Rene test is going to assess bone conduction versus air conduction. I'll be placing it right back here, and I need you to tell me when you stop hearing it.
Okay.
And then I'm going to move it to in front of your ear, and I'll need you to tell me when you stop hearing it when I move it there. Okay?
Okay.
Okay. And you do have really good hearing. I'm extremely impressed.
My mother says that must be on cotton.
Well, the bone conduction versus the air conduction is in the correct ratio. The air conduction is twice as long as the bone conduction. I noticed as I was counting the seconds, so that is excellent. And you did hear it for an extremely long time, I thought, so you do have extremely good hearing. So we'll have to tell everyone not to whisper around you.
Don't tell them that I'll miss stuff.
Okay. We've checked your skin, we've checked your hair, we've checked your nails. If you would, I have one more test I would like to do. If you would stand, please. Put your feet together, your hands at your side, and I want you to leave your eyes open. And then when I tell you, I want you to close your eyes, closed until I say. Okay. All right, if you would close your eyes. This is the Romberg test, which assesses for equilibrium And,